As part of the Affordable Care Act legislation, communities must assess their health needs on a regular basis. Just recently, the Community Health Needs Assessment was released for our area. This week, we'll talk to a variety of organizations about what was in the report. That's next on WNIN Newsmakers. Now, here to explain Community Health Needs Assessment is Lynn Herr from the Vanderburgh County Health Department. She is the Director of Community and Outreach Division. So thank you so much for joining us.
Thank you for having me.
So tell us more about this Community Health Needs Assessment. I mean, so many of us don't know what this is, don't know why we do it or how often we do it. So can you please explain more about this for us?
So both hospitals have to do this as part of the Affordable Care Act. Okay. So both St. Vincent, Evansville, and Deaconess hospitals are kind of charged to do this. And actually the health department, as part of their public health accreditation, is also charged to do this. So it only made sense to do this assessment as a team sport, and everyone that cares for individuals within our community would be involved in this assessment.
So how often do you do this, and kind of walk us through the process? Is this surveys, or do you take data from some of the hospitals? How do you assemble this whole thing?
So again, it is surveys, and it's talking to individuals that receive services and individuals that provide, or agencies that provide services as well. We gather as much information, and then we also look at the hard data. Mm-hmm. You know, things that are put out at the state level and local level, looking at infant mortality, looking at food insecurity, looking at mental health rates. I mean, it just kind of goes on. And then that assessment is looked at by the group and also by Deal Consulting that helped us put this together, and decide what our top 3 needs were. Okay. For Vanderburgh County. And then what kind of things we could do as an improvement plan so that we could see the needle move on these individual kind of dashboards.
And how often is this done?
It's done every 3 years.
Okay, okay. So really, from a viewer standpoint, this is a good thing, because all of the medical providers are getting together and trying to figure out what we need in our own community, and then you put in plans in place to try and overcome some of these challenges?
Right. Then we kind of look at, okay, what kind of interventions can we do to improve infant mortality? What kind of interventions can we do to improve the mental health of our whole community, right, so that we have better outcomes for all of our citizens?
So what are some of the trends that you've seen? Like, what are some of the things that came out as your top 3 or top 5 this year? And are you seeing the same things over and over?
Well,
or how's that kind of?
To think that you could make vast improvements in something in 3 years is really hard. And unfortunately, in the last 3 years, in the last assessment and community or improvement plan that we had, we also had a pandemic, right, that kind of made everything worse. Not that our interventions didn't continue, but there just were some big roadblocks or some big hurdles to overcome. The things that have always kind of risen to the top is mental illness and substance misuse. Okay. Mm-hmm. One of the other things that has always risen to the top is obesity, inactivity, and food insecurity. And then one of them that has also risen to the top is infant and maternal mortality, or poor infant and maternal outcomes. And then across that whole board, it was identified that access into all those services, mm-hmm, is a challenge, and how we were going to address access in all 3 of those areas is what we've focused on here in Vanderburgh County.
So access has come up in some other conversations that we've had. So give us a peek into what everyone means by access. Is this, I don't have insurance? Is this, I can't get in with a provider? Is this, I don't have transportation? Is it kind of all of that?
It's all of them. And each area of the county also has unique issues as well. Yeah. You know, and so looking at how we can make transportation better. And one of the things that we've really identified too is, you know, we have a large provider that's just outside of our county in Warwick County with Gateway out there. And that's really difficult for public transportation because they don't cross the county line. Are individuals that don't have a car. At this point, after post-pandemic, it's even harder to get a car and more expensive to get a car, and gasoline prices and all the things, and the roadblocks to utilizing Medicaid cabs, and just, I mean, it just goes on, and we have to break those down and decide as a community how we can improve those things.
So when we talk about improving access, are there any specific strategies in place? Are there any interventions that are already in place that we need to know about or that you're looking to improve on?
So the Wellborn Foundation and a group of the same kind of partners are very much involved, along with our business leaders, for Talent 2025 in our community. And so there is a subcommittee just around transportation that is working very hard on specific, you know, things that are being put in place, especially regarding that crossing the county line, sure. And those kind of things, and then local solutions and agency solutions of actually providing transportation and what that would look like for our community.
Well, you've mentioned it, and Representative Hatfield mentioned the issue with infant mortality and maternal mortality. So he had mentioned we're one of the worst in the states.
Unfortunately, for our Black infant mortality, we are second highest in the state of Indiana, for our county.
What goes into that, and what are some of the things that are being done to really address that, and what can people do to help improve this? What can we do as a community to help improve that?
So first of all, it's awareness, to understand that a woman that is pregnant or a Black infant born in our community has a 2.5 times to 3 times higher chance of not making it till the first birthday. And it's very multifactorial. There's so many factors that play into this. So we have to look at that. And one of the things that we do is called a fetal infant mortality review board. And that is taking each individual case and breaking it down and trying to find problems with access, problems with insurance, all the things that can play into that loss. Sure. But then we also have the health department has our Pre to 3 program, which is a home visitation program for any woman feeling like they needed a little more support throughout their pregnancy, and we follow that child until their 3rd birthday. Wow. And so that helps with resources, it helps with access, it helps with housing insecurity, and all the things that go along to raising a family and breaking down some of those intergenerational roadblocks to having a successful family.
So if someone wants to get involved in the Pre to 3, or they know someone who should be involved with Pre to 3, how do they get started with
Just go to our website. Just go to the Vanderburgh County Health Department website, and there's plenty of information there and a link to our services.
Okay, thank you so much, Lynn. We appreciate your time.
Okay, thank you.
Andrea Hayes, the Program and Community Engagement Officer for Wellborn Baptist Foundation, joins us now. Thank you for joining us today.
Hey, thanks for having me.
So the Wellborn Baptist Foundation focuses on active living, healthy lifestyles, things like that. So what findings in the Community Health Needs Assessment is of most interest to your organization, what you're looking to accomplish?
Well, one of our, what we call impact areas, is focused on healthy eating and active living. And that's essentially, it's a proxy for how do we create healthy lifestyles, across the region. So we are, of course, looking at the CHNA and the data and what the community shared in the sessions that were a part of this process, and saying, okay, this is how we can help. This is where we can invest our funding, our efforts, and help promote partnerships in different areas.
So without having the assessment kind of in front of us or as part of that report, so did exercise and healthy living kind of bubble up as yet another need within our community that we need to focus on?
Yes, it did, because unfortunately, we continue to see higher rates of overweight and obesity in our region. That didn't change this time around. And so, we look at it as what is causing that? And it's definitely, there's influences, right, that create, unhealthy weight. So ultimately, are people able to access the foods they need to live a healthy lifestyle? Are they able to be active, physically active? It's great if they can access a gym, but what about in their neighborhoods? What about near the schools? Can they walk? Can they go for a bike ride? Can they go for a run if they choose to do so? Are there destinations connected where they can make it part of their daily routine? Yeah. So those are the types of I guess you could say community aspects that are making up whether or not people can lead an active, healthy lifestyle.
Sure. So I'm sure this is not the first time that obesity and exercise and healthy lifestyles have come up in this assessment. Has it been an issue previously? And if so, what kind of progress? I mean, I know there's a lot of work being done in this area. So what kind of progress has already been made? Yes,
it has come up before in multiple assessments, and it's come up in other community assessments before this. Thankfully, the CHNA has to kind of keep us on an every 3-year track to reassess. But I think most importantly, there is an active collaboration underway. The Healthy Communities Partnership began about 10 years ago, and their main focus has been addressing how to advance healthy food access and opportunities for active living across, especially Vanderburgh County. There is some work being done in the other counties as well. And so, that is a 10-year process where we're looking at how to create policies and systems and environmental changes, things like changes in the food system. How do we create a more equitable and accessible food system for everybody? I talked about trails already, but we think sometimes trails are to go for a leisurely bike ride, and that's great. That's so important. But a lot of people actually use active trails as a form of transportation, what we call active transportation.
Yeah.
And so not only are they able to maybe hop on their bike to get to work or get to school or wherever, but it's also they're integrating physical activity into their lifestyle. So there's no need to necessarily schedule it for before or after work, right? And that's what the Healthy Communities Partnership is really working to do, is creating those policy systems and environmental changes that will advance that work. There's been some great things that are happening. Last fall, the Evansville Trails Coalition worked really hard and tirelessly to get with the City Council of Evansville to have the Complete Streets Ordinance passed.
Awesome.
Which means, every time they look at a road project, they're saying, how can we make accommodations for all users of this road, not just the motorists, but also folks who might be using it for cycling or walking or pushing a stroller or whatever. So yeah, there has been some great work that's happened, and I think there's also some momentum with the Talent EVV initiative, which is now about 3 or 4 years underway. And in that initiative, there's a whole focus called Live Well. It's basically looking at the health index of our region, so the broader region, and saying what is making up the biggest health indicator? What are those health indicators that are kind of creating that profile for our region? And out of that also was the unhealthy weight, and essentially getting more people to be physically active in whatever works for them, getting more access to nutritious foods for people. And so there are some strategies within the Talent EVV process that are being advanced as well.
Well, and when we think about how all of this works together, really it's like any other issue. It's complex, right? Whenever you're dealing with obesity and things like that, poverty comes into play there. It's the whole social determinants of health. Absolutely. It's the built environment, like you mentioned, trails and those types of things. So what are some of those complex issues that I know that Talent EVV and Wellborn Baptist are really looking at, but it's more complex than just saying eat right, right?
Absolutely.
It's how we work together and kind of the holistic person. And also with mental health, tell us a little bit more about the Mental Health First Aid Initiative, because that kind of goes into being healthy overall. And when you mentally feel good, you feel more motivated to be healthy, correct?
Oh, that's absolutely right. And so, we talked about the Talent EVV project, and there is a Live Well whole area, focus area. And there is a strategy team that's specifically looking at how do we create ways for our workplaces to foster a healthy environment. You know, there's those traditional workplace wellness programs, which are fantastic, but coming out of COVID, the mental health aspect has really been elevated. And we've heard that from employers. And so this year, currently in 2022, we are underway in a mental health first aid pilot where we're providing a training. It's just a one all-day training session for the people who are serving their employees, you know, whether it's HR managers or, you know, whatever, associates. And it provides them with the tools that are necessary if they have a colleague who is maybe in a little bit of distress, and it helps them through that. It helps them walk through that with them, so they don't say, "Boy, I don't know how to handle this." It provides them with those tools. In just a one-day session, we've received a lot of really great feedback on that. And what that does, you know, to your point, is it provides them with the tools necessary to interact, to have those moments that can be a little bit difficult, but it also could help connect that person who might be in distress with the resources they need in the community to get on, you know, a path to wellness, both mental and physical. Because you're absolutely right. If you're not feeling there, it may be tough to get yourself outside. It may be tough to think about eating those foods that actually nourish your body. Because sometimes when we think of comfort food, it's not always the healthiest things, right? We all have those go-to items that we want. But I think it's, you know, getting back to what you originally had asked about, it's about providing access. Through the mental health first aid training, we're providing access to tools and resources in the community. But also, we're wanting to provide everybody with access to healthy food. And that also was elevated in the pandemic, that there's a lot of disparity. Not everybody was able to get what they needed. And same with quality of place type initiatives. You know, we think those are just nice things to have, but what we realized when we were kind of stuck at home is people need a place to get out and to get that fresh air, which also helps with mental health, as well as get just that physical activity, whether it's a walk or going for a bike ride, pushing the stroller, whatever that is. People needed those spaces and places, and ideally, if we can connect them, that just leads to overall better quality of life.
Wonderful. Thank you so much for all of your information, Andrea. We appreciate your time.
Thank you.
Now joining us is Emily Reedford, Vice President of Community Outreach and Education at Easter Seals Rehabilitation Center. Thank you so much for being with us.
Thanks for having me.
So tell us about, how did Easter Seals get involved in the Community Health Needs Assessment? What was your role in this assessment?
Yeah, well, we've been part of the Community Health Needs Assessment since the beginning. You know, all providers, community leaders, and community residents are surveyed to put forth some of the data for the needs assessment.
So whenever you talk about your role, so how did you get involved? What was your level of involvement? I know you mentioned survey. So how do you get through all the data that's collected? How do you kind of assemble that and then come up with what you determine as the needs, especially within the mental health arena?
Yeah, so we're so lucky that Deal Consulting Group is one of our great community partners who's helping to combine, analyze, and then spit out the data for what we can look at. My role has been mainly in the mental health segment of that need, and really working with our community partners and our other mental health providers, kind of coalescing everybody within that field and saying, what can we do? How can we move the needle? And what more work still needs to be done?
So of course, mental health's been a big topic. And thankfully, we were kind of changing the stigma on mental health before COVID hit. And then COVID really shone the light on it. So where did mental health fall within the needs assessment? And has it changed from needs assessments in the past, the focus on mental health?
Yeah, mental health has always been a huge need, especially for our area. And we've seen that through the Community Health Needs Assessment. It's been on that list of the top 3 since 2016, I think. But I think what COVID did was really kind of shine this light on it. Like, we have to do something now. This is now not only a problem for those people or for the ones that we had been currently serving, but now it's a problem for the masses. And the sheer number of people has really put a strain on our mental health system.
So with this kind of rising to the top once again, and it having been at the top, what are the plans? When you guys, when all of the providers and all of the healthcare providers take a look at what is coming out of the assessment and the report that comes out of that. How do you take that information and then move forward? Do you strategically plan off of that, or what are your next steps?
We do, and these are high-level plans. Okay, so we will have a committee actually of mental health providers, people in the field, to really look at what does this data mean, what can we realistically do, and what are some of those short-term and long-term goals that we can put in place. So for example, we have been working on mental health first aid trainings, and that was a program that was initiated from the 2016 Community Health Needs Assessment. So we're looking at how do we continue that program, how do we further those efforts while adding on other pieces of the puzzle.
Lots of providers to bring together, and it's always good to see every provider working collaboratively. Are you finding that people like the providers in this space and the organizations in this space are starting to work together and kind of put these pieces together in terms of what needs to be done? And whenever you look at an assessment like this and start to make those plans, how long is kind of the implementation phase of some of the ideas that come out of that?
Yeah, well, luckily here in Evansville, we are a collaborative community, and I think all of us in the mental health space world at least know that we can't do this without everybody's help and input because there's too much work to be done. So that actually helps us look at things strategically. What can different providers offer that maybe others can't? One of our strategies is actually going to be identifying what are our gaps in services and treatments, what are our needs atop of mental health, but what specific programs and services are we lacking in this area? And that's going to really give our committee guidance on how can we move forward, how can we fill those gaps working collaboratively.
Great. Well, wonderfully, we have heard about some grant funding and some money that's going to be pushed into our community, and also other grants within our community that are being made in the mental health space. So we're at least getting more money that is going to help address the issue. But tell us a little bit more about, it's not just about money. Talk about some of the other factors that go into improving our community in this area.
Yeah, certainly funding definitely plays a huge impact on what services can be provided and how much of those services can we give to our community. But there are other factors at play when you're talking about mental health. So do we have certain programs or services? Do our community members have access to them? Are there wait lists for treatment beds or certain programs? Do you have physical access, transportation to get there? Can you take time off of your job to go get treatment or help provide treatment for a family member or something like that? So there are some gaps there that, again, this Community Health Needs Assessment Committee is really trying to look at what are those barriers and how can we not only put those programs and services in place in our community, but how can we help get our people to them?
Right, and I know that access to care was pretty much a concern in that report, and that's what you're alluding to,
Absolutely.
correct? Transportation, all of those types of things, even insurance and payer types of things, and providers, right? Are we at lack of providers in this area?
We are, and when we talk about funding for mental health, it's not always just grants and fundraisers and that kind of thing, but it's really specifically looking at what are the insurance companies willing to reimburse for those treatments and those services provided? What do the Medicaid rates look like, and that kind of thing. So those kinds of funding issues continue to kind of hurt our mental health efforts a little bit. So we know there's work to do in that area.
Well, and when we talk about, the Community Health Needs Assessment is not just our city and not just Vanderburgh County, but also Warwick County is involved in that as well, correct?
Absolutely. Warwick County is definitely involved in that, and led by our two regional hospitals, we're looking at this regionally, right? Mm-hmm. Evansville being a bigger city in Indiana, we have people coming from the tri-state area, Illinois, Kentucky, and Indiana, coming to get treatment. So we need to look at this big picture as well.
So now that you've got this assessment, are you looking to Easter Seals specifically? I know you can speak on this. Are you looking to expand services somehow, improve some of that access, and what might that look like in the future?
Yeah, so Easter Seals has been doing mental health services for its entire 75 years almost in existence. But we are looking in the near future to expand those. So Dr. Jim Schrader and his team works in the clinic in our building right now. And we're looking to expand. Not only will that bring more providers to Easter Seals, but Dr. Schrader's team is so great at training new residents and new providers to be able to work right here in Evansville, we hope. So that's going to, help fill that gap with needing more highly skilled, trained professionals.
So when you talk about Easter Seal's scope and your service area, if someone is watching in our viewing area, what's the reach for Easter Seals in terms of who can come? Who can be
Yeah, so anybody can come and access our services, even our mental health services. So Dr. Schrader's team is great at helping navigate that clinically. But if someone is just kind of stuck and looking for some kind of provider, they can call up to my office, and if Easter Seals can't serve them, we're happy to help get them in touch with other providers who may be able to. Southwestern Behavioral also employs a navigator for mental health resources funded by both Deaconess and Ascension St. Vincent Evansville, who are on the community health needs assessment as well. But that navigator will can help anybody in the community get in touch with mental health services as well.
Great. Fabulous information. Thanks for your work in this area.
Thank you.
Appreciate your time. Thanks to all of our guests for talking about the Community Health Needs Assessment. Next week, we'll discuss what disasters might happen locally and how you can prepare for them. Thanks for watching WNIN Newsmakers.